Venipuncture equipment. So for phlebotomy equipment, as a phlebotomist, your primary duty is basically to collect blood and prepare it properly for delivery to the laboratory for, analysis. The equipment includes needles and tubes that can help you to collect the patient's blood. You're also going to have materials that will ensure that a vein can be located, such as a tourniquet, making sure that the puncture site is clean, such as alcohol, and the sample is labeled and transported correctly. Phlebotomists will usually have a portable tray that can actually carry all of the necessary equipment, just like the picture below. For organizing and transporting your equipment, you need to make sure that you keep your tray well stocked, clean, and organized. A lot of places will have certain locations for tubes, and that's just to make sure, like once you go home for the night, the next person coming in knows exactly what is missing or what needs to be, included in your tray. It just makes it a lot easier for everyone involved if it is clean and organized and well stocked. To clean it, you can use a 10% bleach solution. And you will encounter patients in two different settings, and you'll have an inpatient, which are people who have been admitted to the hospital. Usually you're going to draw their blood at the bedside. And then you're also going to have an outpatient. And outpatients usually come to you at a clinic or a hospital type setting, but they're walking in. They're not in their hospital bed or anything like that. So this would be like a doctor's office, something like that. For locating veins, a tourniquet is the most common way to help locate that vein. The tourniquet prevents venous blood flow out of the arm, which actually causes that vein to bulge or kind of protrude, and that's how it'll help you to visualize where you can see the vein. The tourniquet may be latex or non-latex, though most of them nowadays are non-latex. And then once the tourniquet has been used, it should be disposed of to reduce the risk of pathogen transmission between patients. So it is essentially a one-time use tool that you are using. So once you use it, toss it, get a new one. So cleaning the puncture site and helping to protect that puncture site. So the most commonly used antiseptic is 70% isopropyl alcohol, also known as rubbing alcohol. Isopropyl alcohol is bacteriostatic, which means that it basically inhibits the growth or reproduction of bacteria, but it does not kill them. So after you complete your venipuncture, we will usually use a 2x2 inch gauze square that helps stop the bleeding for the puncture site after, like I said, the needle is removed. So what is an antiseptic, going back to before you even perform the venipuncture? So an antiseptic versus a disinfectant. So by convention, the antiseptic refers to an agent that is used to clean living tissue, and a disinfectant is usually an agent that is used to clean a surface other than a living tissue, so like a countertop. Needle. So if you've ever looked at a needle, you will see that it has a point, a bevel, and a shaft. So if you look at the picture, there's kind of that point and it's got like an angle down. That is actually the bevel. When you are drawing the blood, that bevel needs to be up. So in a routine venipuncture, a needle inserted into a vein allows blood to flow out into an evacuated collection tube or the syringe. All needles used for phlebotomy are sterile, disposable, and they are only used once. And you need to make sure that you inspect each needle package before opening it, and that just kind of makes sure that it hasn't been contaminated or anything like that. And if it has, we actually are going to go ahead and discard that. We don't want to use a possibly contaminated needle on any patients. So going back to that bevel, like we talked about earlier, it needs to be up, and that helps for flow, like I mentioned, into the blood tube. So if you have that bevel down, if you look at that picture at the very bottom, and it's going into the vein, it's not really going to go in, right? It's going to kind of just go around it for the most part. The shafts differ in both length and gauge. So the most commonly sized gauge needle that we use is a 21 gauge. And when you get into your clinicals, you'll see the different sizes. So you've got usually 21 and 23 are the ones that you're going to run into. So going back to gauge, like we talked about on the previous slide, so the gauge describes the diameter of the needle's lumen. This is actually kind of reversed than what you would think. So the larger the number, the smaller the lumen. The choice of gauge is not a matter of personal preference. It really is going to depend on the type of collection and then the condition of the patient as well. So for adults who have like normal type veins, you're generally going to use that 21 gauge needle. But for children or adults that have small veins, you're actually going to go ahead and use that 23 gauge needle. There are some factors that could influence the choice of which gauge you're going to use, and that would include the location and depth of the vein that you're trying to access, and the experience and preference of the phlebotomist. And then we also are going to talk about the hub. So that picture at the bottom is an example of a hub, and that is actually what the needle attaches to, and then it attaches to the collecting tube or the syringe as well. So it's kind of the middle point that connects the needle to the tubes. A multi-sample needle. So this actually is the needle that you'll probably use the most often. And you will see this when we do our clinical rotations and stuff as well. So it may sound a little confusing at the moment, but there is the needle, which is the part that actually penetrates the skin. And then there is a second needle or tip that actually pierces the rubber cap of the tube. So that second tip that has that rubber cap is actually the one that goes inside of the hub. And then when you put the tube in there, that is actually what pierces it, and then that is what allows the blood to flow through. So the actual rubber sleeve tip does not go into the patient. That is just the one that is for the tube. So when we are working with those needles, you'll see what I'm talking about with this. Safety syringes and safety syringe needles. So a syringe is sometimes useful for patients that have fragile or small veins. When the vacuum of the collection tube is likely to collapse the vein, a syringe can also be used because you are going to control that pressure. So with a syringe, the needles can come in ranges of sizes. The most common is 22 gauge and 1 inch long. So with a syringe, you're going to use it by slowly drawing back the plunger. And like I mentioned, the syringe provides you to actually control that vacuum or that pressure that's actually going to be drawing the blood from the vein. A syringe needle can also be called a hypodermic needle, and it fits onto the syringe of the barrel. You can also use a winged infusion set, or what we like to call a butterfly needle. These are used for venipunctures on small veins. These are usually used in like hand veins if you have to draw from a hand. We can also use them on elderly or pediatric or kids as well. The most common needle size in this is 23 gauge. So remember, the numbers get larger, but the needle sizes actually get smaller. So most butterfly needles are now designed to be used with an evacuated tube system. So what that means is if you look on that picture, you can kind of see the blue wing looking thing. And then there's like a gray or black colored thing over there as well. That is actually where you can connect the hub. And then that is where you can actually, put all your tubes and it'll collect it just as normal. Needle safety. So OSHA issued a directive in November of 2000 that actually stressed the use of safety devices that would help to reduce the number of sharps injuries. The Needle Stick Safety and Prevention Act specified types of engineering controls that were mentioned in OSHA's bloodborne pathogen standard to help increase needle safety. The CDC estimates that hospital healthcare workers in the United States experience about 385,000 sharps-related injuries per year. So there are self-capping needles that have a plastic sheath that actually snaps shut over the needle when we're done. There are retractable technologies that cause the needle to retract into a syringe, tube holder, or other device as well when you're done. There are Vacutainer push button collection sets. So some of those winged or butterfly needles have a push button. So when you're done collecting the blood, you push a button and it actually pulls the needle right back. So you don't really go anywhere near the needle, which is nice. Workplace practices play a significant role in reducing exposure during patient care procedures. So, making sure you know your facility's policies and what you are using and how to use it is going to be super important. Needle adapters. Needle adapter is a translucent plastic cylinder. One end has a small opening that accepts the multi-sample needle. The other end has a wide opening that accepts the collection tube. For most collections, you are actually going to be using, like I mentioned, a multi-sample needle and an evacuated collection tube. To ensure a firm and stable connection between these, there are two essential parts. So you have that needle adapter, which is also called a tube holder, is going to be used. Those adapters have a tube advancement mark indicating how far the tube can be pushed in without losing that vacuum. So going on to evacuated collection tubes. So these are color coded generally, and what the color means, it's going to depend on what you're drawing and what you're drawing for. Each color has a different additive in it. Some actually want the blood to clot, and others prevent it from clotting. So that's why it's very important to know what tubes you need to draw for which test. Most of the time now, a lot of times on your patient labels, it'll actually tell you what color, which is very nice. But you may run into a place that does not have that, so you will need to know. And you may also run into a time where you have a test that isn't ordered very often, and you're going to have to look that up. So make sure you know what to do in those situations as well. Like I mentioned earlier, each type of tube may contain different sets of those additives, which is basically a chemical that is designed to promote or prevent certain changes in the blood sample. Like I mentioned earlier, to clot or not to clot is the most common. The best tube size to use is going to depend on several factors. Each test is going to require a minimum sample volume, and that could range anywhere from less than 1 milliliter to up to 10 milliliters or more. Like mentioned earlier, lots of times those are even included on the patient label now as well. Each tube carries an expiration date, and unused tubes must be discarded when they expire. So that is actually something that you need to check prior to drawing every single patient. You may have a tray full of tubes, and maybe that one purple tube has been hanging out, somebody's just kept refilling and refilling, and you just never really got to that tube. So now it could be expired. And when that happens, you can have erroneous results for the patients, and it may not do what it's supposed to do as far as, clotting or not clotting of that blood. So make sure you are checking expiration dates. Like I mentioned earlier, out-of-date tubes may have decreased vacuum, so you may not get the volume that you need, or they may have additives that degrade with time. There are different types of blood specimens. Whole blood is mixed with an anticoagulant so that it will not clot, and this is usually for hematology, and that's usually in your light purple tubes. Serum is the fluid portion of the blood that remains after clotting, and then plasma is the fluid portion of blood, including fibrinogen and other clotting factors. So there are certain tests that require serum, and some that require plasma, and some that require whole blood as well. For those tubes that need to be clotted, like the serum, it could take 30 to 60 minutes for that to occur. So you would not want to throw that into a centrifuge right away, which we'll talk about later. Unlike plasma, serum does not contain fibrinogen or some other clotting factors, which are left behind or used up in the forming of the clot, and thus cannot be used for routine coagulation studies. Plasma is obtained by collecting whole blood in a tube containing an anticoagulant and then centrifuged. And then plasma is also could be used for coagulation studies as well. As mentioned before, the tubes do have additives in them, and any of them that actually have an additive, you need to make sure that you are inverting these tubes. So make sure they're mixed well immediately after you take them off of the adapter. Most of them need about 5 to 8 inversions, so just flipping them, up and down, that's one inversion. Make sure you do not shake the tube because this could cause hemolysis. Tube additives are identified by the stopper color, and many tubes are coated with silicone to help prevent blood from adhering to the wall and to slow clotting. There are also anticoagulants that help or actually prevent, the blood from clotting. There are different anticoagulants that work in different ways to prevent that clotting and yield of plasma. So EDTA, citrate, and oxalate will actually bind the calcium. that helps to prevent the clotting. And then heparin actually inhibits the conversion of prothrombin to thrombin, and that is how it prevents the blood from clotting in those tubes. So EDTA is your purple, and then sodium citrate is your light blue top tubes. Heparin is generally going to be your green top tubes. The choice of anticoagulant is, like I mentioned earlier, going to be determined by the test that is ordered. There are also clot activators. So thrombin directly increases clotting and is used for stat serum chemistry determinations or if the patient is on anticoagulants. Clot activators may be adhered to the side of the tube, therefore the sample must be inverted once again 5 times to allow the blood to come in contact with that activator. So when you get to clinicals and you look at your tubes, sometimes you can actually see, those little dots on there, and that is actually the clot activators on the side there. All right, so we look at polymer gel. It is an inert synthetic substance whose density is between that of cells in blood, serum, or plasma. So when the sample is centrifuged, the gel becomes a liquid and moves between the lower cell layer and the upper serum and plasma layer. So what this does is it actually separates the plasma part of the blood, so that liquid part of the blood, from your red blood cells. So you'll have the plasma on top, and then you'll have that yellow. If you look on the picture, there's that yellow on the bottom. That'll actually move up the tube and go in between that plasma part, and then your red cells are going to be at the bottom. So it'll be plasma, that serum separator, and then red blood cells. You have color-coded top tubes, and you will learn all about these in your clinicals and which ones you should use for what. So I'm going to go ahead and let you guys read through these for each one that we have. Order of draw. So this is very important to draw in the order that is stated here. Since we use the same multi-sample needle for each tube, so we'll put the needle in the patient's arm, and then you'll get one tube, you'll move on to the next tube, move on to the next tube, and then you take the needle out. So that's what I mean by saying you're using the same needle for all the tubes. So since we're doing that, sometimes the material from the tube before could actually be transferred into a different tube because it could technically contaminate it. So we need to make sure that we do the correct order of draw, and that will actually help reduce any of your samples being contaminated. So the order of draw is you will start with blood culture tubes, and this prevents the transfer of unsterilized material from other tubes into the sterile tube. If we're testing for blood cultures, this means that we're looking for bacteria in the blood, and that is why it's very important that it stays sterile. The next one we are going to do is a light blue tube. These are always drawn before tubes containing any other kinds of anticoagulants or clot activators because these other additives could contaminate this tube and could interfere with coagulation testing. The next one we're going to do is your glass red top tubes or your plastic red top tubes. And then we're going to do a red, gray, or gold top tubes. And then we're going to move on to green because the heparin is less likely to interfere with EDTA tubes. And then our last tube is actually going to be your lavender tubes, which are your EDTA tubes. The gray top tube is going to be the last one. This contains potassium oxalate. The potassium in that could actually elevate the potassium levels measured in our chemistry testing, and the oxalate can actually damage cell membranes as well. Other colored tubes are typically drawn after these 6, but you should check the instructions on the manufacturer's package insert and your laboratory's procedure manual for specific information, as it may be a little different than what is mentioned here. So it's just a visual on the colors of what you should be drawing and in what order. And then once you have withdrawn the needle from the patient's arm, it must be handled with extreme care because we do not want to have an accidental needle stick. So we are going to dispose of these into a puncture-proof container. These are considered biohazardous waste and need to be treated as such. So these containers must be closable or sealable. They must be puncture resistant, leak proof, and they have to be labeled with that biohazard symbol. So you will actually dispose of that needle with the adapter still attached immediately after activating that needle safety device. Then, as mentioned, they need to be marked into that puncture-resistant biohazard disposal container, which you will actually see in each patient room and in each drawing station as well if you are in an outpatient setting.